Hi, I'm Dr. Rahman, and welcome to Menopause No Filter. We spent a couple of weeks talking about vaginal dryness. Do you remember when? Do you remember when it used to be wet? Do you remember when just the thought of sex would cause you to lubricate? But things have changed. It's not that way anymore. And odds are, if that's happened to you, you have not talked to your gynecologist about it. You've just dealt with it. You've just given up on sex, maybe. You've tried other things. You've Googled. Well, this is important because the vaginal dryness affects the quality of your life. Having a good sex life affects the quality of your life. Think about it. The quality of your life is affected by the quality of your sex, if sex is something that is important to you. And so we've spent several weeks talking about vaginal dryness, but you need to understand that vaginal dryness is one of the constellation of symptoms that can occur to women in the peri and postmenopause. And these constellation of symptoms such as vaginal dryness or pain with sex or vaginal tightening or urinary pain or urinary frequency or even urinary tract infections all can increase in frequency and severity in the peri and postmenopause. And this constellation of symptoms are grouped together and they're called genitourinary syndrome of menopause. Genitourinary syndrome of menopause. GSM. The real deal. And what I'm pausing to talk about is that recently the American Urologic Association published its 2025 paper outlining guidelines for patients and clinicians who have genitourinary syndrome of menopause. This is big news because this was a professional, well-done paper outlining 26 guidelines, validating for so many women that this is real, that they're not alone, that steps need to be taken to address this issue if it becomes a concern in your life. But I have a concern with the paper that's been published and the 26 guidelines. And my concern is this: of the 26 guidelines, 18 of them are not based on studies with evidence. 18 of the 26 guidelines are clinical practices and expert opinions. The remaining 8 guidelines are based on evidence, but they go on to say that the evidence is weak. So that tells me 2 things. Yes, it's wonderful that we are finally validating something that women have been suffering from for a long time. It's good to know that it is being recognized and it's being validated. But the second thing it tells me is that we have not done a good job. We need to do more study. There needs to be better recommendations based on better studies, based on better, higher quality of evidence. We deserve better. So don't suffer alone. Know that it's real. Know that there are other women experiencing things comparable to what you're experiencing. And know that they need to be addressed. Next week, I'd like to talk about two things that has not made it into the medical circle a lot, and that's the yoni ache and also the red light that's being suggested by Holly Berry for treatment of genitourinary symptoms of menopause. And so until the next time, this is Dr. Rahman saying, take care.